Welcome back.
All right, so last time, right, we were talking about all the amazing tools that orthodontists use.
Right.
But, like, the journey to a perfect smile
Yes.
doesn't end when the braces come off, right?
Absolutely not.
I remember having to wear retainers.
Yes.
And honestly, I wasn't the best at, like, being consistent.
Right.
So, like, what's the big deal with retention anyway?
Retention is crucial.
Okay.
It's absolutely crucial for maintaining the results of orthodontic treatment.
Gotcha.
So think of it like this.
Okay.
You know, those teeth
Yeah.
have been moved into new positions,
Right.
but they haven't quite settled in yet.
Okay.
So they have a tendency to want to drift back
To their old spots.
to their old spots.
Yeah, so it's like it's like those little fences you put around newly planted trees.
Yes, that's a great way to put it.
To keep them straight, right.
Retainers hold those teeth in their corrected positions,
Right.
while the surrounding bone and tissues
Okay.
remodel and adapt.
So, okay, what kind of retainers are out there?
So we've got three main types.
Right.
Holly retainers,
Okay.
transparent plastic retainers, and fixed retainers.
Oh, I remember Holly retainers.
You do?
Yeah, those were like the classic ones when I had braces. Like back in the day.
The Holly retainer is a removable appliance
Okay.
made of acrylic and metal wires.
Right, right.
It fits snugly over the teeth and uses those wires to hold them in place.
Okay, but I do remember them like being kind of hard to keep clean.
That's true. They do require consistent cleaning,
Yeah.
and patient compliance is key.
Gotcha.
If they're not worn as instructed,
Yeah.
those teeth can start to shift back.
Yeah, I definitely learned that the hard way.
I bet.
What up those transparent?
So transparent plastic retainers, like
Yeah.
the Essex retainer,
Okay.
they're practically invisible,
Right.
very comfortable to wear.
So they sound great.
They are a popular choice,
Yeah.
but they can sometimes interfere with the teeth settling into their final bite.
Oh,
And they're also more prone to staining
I see.
than Holly retainers.
So it's like a trade-off, right?
It is, yeah.
Okay, and then what about those fixed retainers?
So fixed retainers are bonded to the back of the teeth. Usually the lower front teeth,
Okay.
they consist of a thin wire that's glued in place, providing continuous retention.
So you don't have to, like, remember to wear it.
Exactly.
But I imagine, like, flossing with that thing.
Flossing with fixed retainers definitely takes a little more finesse.
Yeah.
You have to thread the floss under the wire,
Mm-hmm.
which can take some practice.
Right, but it's like, it seems like they've developed so many different tools. Like,
They have.
it's amazing how far
It is.
dentistry has come.
It really highlights the importance of personalized treatment planning.
Right.
So the orthodontist carefully considers the patient's needs, their lifestyle, their risk factors,
Gotcha.
to choose the best retention strategy.
So we've journeyed from, like, understanding those tricky class I malocclusions
We have?
to, like, the mechanics of braces and now retainers.
Yeah.
It's been, like, a whole dental adventure.
It has.
But I feel like there's, like, still so much to learn.
There.
What else should our listeners keep in mind as they navigate their own, like...
Well, one of the most important things is to understand the long-term implications of early intervention.
Okay.
Our research really emphasized how crucial those baby teeth are.
Right. It's easy to, like, think of them as, like,
It is.
temporary, not as important.
Yeah,
But they really do.
they do.
Set the stage for a healthy bite.
Exactly.
They act as placeholders, guiding the eruption of the permanent teeth.
Yes.
And maintaining space in the dental arch.
That's right.
And that's where, like, those space maintainers come in, those little appliances.
Yes.
They keep the neighboring teeth
That's right.
from, like, crowding into the gap.
Early intervention is key to preventing more complex problems later on.
Okay. And we also talked about
Right.
the importance of maintaining the proper arch length
We did.
and width.
Yes.
Do you remember all those
I do.
appliances?
Yes.
We had those
We had the transpalatal arches,
transpalatal arches.
the lower lingual holding arch.
Yeah, and the Nance holding arch.
That's right.
I still get them mixed up.
I understand they are a lot of terms.
Can we do, like, a quick recap?
Sure.
Just to make sure everything's, it's like, crystal clear.
Okay, so the transpalatal arch is used in the upper arch,
Okay.
often after expansion.
Uh-huh.
It prevents those back molars from tipping inward, which is really important for maintaining the width of the arch.
Okay, so it's like a little brace that, like, spans the roof of your mouth.
That's a good way to visualize it.
Okay.
Now, the lower lingual holding arch,
Yeah?
that one's a fixed appliance that does a similar job in the lower jaw.
Got it.
We often use it when a baby tooth is lost too early,
Right.
just to hold that space open and prevent crowding.
Okay.
Think of it like a tiny guardian holding the fort until the permanent tooth comes in.
It's amazing how these, like,
Yeah.
seemingly small interventions
Yeah,
can have such a big impact
they can.
on long-term dental health.
That's the beauty of orthodontics. We're
Yeah.
constantly thinking about the big picture and
Right.
how all these different elements work together.
And then the Nance holding arch.
So the Nance holding arch is specifically designed to maintain the length of the upper arch.
Okay.
It's often used when there's a risk of those molars drifting forward
Right.
and taking up space that the front teeth need.
So it's like a little anchor,
Yes.
keeping those molars in check.
A perfect analogy.
It really is about teamwork
It is.
with each appliance, like playing a specific role
Exactly.
to create the ideal conditions for a healthy and beautiful smile.
That's right.
This whole deep dive has been so insightful.
I'm glad.
I feel like I have like a whole new appreciation for like the complexity and artistry of orthodontics.
It is a fascinating field.
It's not just about aesthetics.
It's not, no.
It's about like building this foundation.
It is.
The lifelong
Yes.
dental health. Absolutely.
So we're back. And I gotta say, I'm feeling like I could open my own orthodontic practice now.
That's the goal.
But one thing that's like really sticking with me is that whole idea of the dental arch
Right.
and like how important it is to maintain the right length.
It is.
And width.
Yeah.
You know,
Yeah.
like if you think of like the foundation of a house,
Yeah.
if that's not solid,
Exactly.
everything else is going to be off.
That's a great analogy, yeah.
So the dental arch is really like the framework.
It is. It's the framework for a healthy and functional bite.
Yeah.
And remember, it's not just about straightening individual teeth.
Right.
It's about creating that balanced and harmonious whole.
And we talked about like a few different appliances
We did.
that help with this, right? Like the transpalatal arches,
Yeah.
the lower lingual holding arch,
Right.
and the Nance holding arch.
Yep, those are our key players.
They're like the unsung heroes. You know, they're working behind the scenes to create the space needed for the teeth to align properly.
Okay, so I got to be honest.
Yeah.
I still get those appliances a little mixed up.
It's understandable.
Could we maybe just do a quick recap?
Sure.
Just so everything's like super clear in everyone's minds.
Absolutely. So let's start with the transpalatal arch.
Okay.
That one is used in the upper jaw, often after expansion.
Mm-hmm.
It prevents the back molars from tipping inward,
Okay.
which is really important for maintaining that width.
So it's like a little brace that goes like across the roof of your mouth.
That's a good way to think about it.
Okay.
Now, the lower lingual holding arch.
Okay.
That one is a fixed appliance.
Uh-huh.
Does a similar job, but in the lower jaw.
Right.
Often used when a baby tooth is lost too early, just to hold that space open.
Right, to prevent crowding.
Exactly.
And it's amazing how these like small interventions can have such a big impact
They can, yeah.
on like long-term dental health.
That's the beauty of orthodontics.
Yeah.
We're always thinking about the big picture, how all these different elements work together.
Okay, and then last but not least.
The Nance holding arch.
Yes.
So that one's specifically designed to maintain the length of the upper arch. Often used when there's a risk of those molars drifting forward.
Right.
Taking up space that the front teeth need.
That's like a little anchor.
Yes.
Keeping those molars in check.
Perfect analogy.
It really is about teamwork, isn't it?
It is.
Each appliance has its own specific role to play.
Exactly.
Wow, we've covered so much ground in this deep dive.
We have.
From like understanding those common bite issues.
Yes.
To like the world of braces and retainers and all these like specialized appliances.
It's been quite a journey.
It really has. And I hope our listeners
I hope so too.
Feel like empowered by this knowledge.
The more you understand about your dental health, the better equipped you'll be to make informed decisions and advocate for yourself.
And don't forget those regular dental checkups.
Absolutely.
Especially for kids.
Yes, early detection is key.
Early intervention can make a world of difference.
A healthy smile is an investment in your overall well-being.
That's a great way to put it.
I think so.
Well, that wraps up our deep dive
It does.
into the fascinating world of orthodontics.
It's been a pleasure.
It really has. Thanks for joining me.
Of course. Thanks for having me.
And to all of our listeners out there, until next time, keep those pearly whites shining bright.